Welcome to Wellness. Uh, Welcome to Wellness Health Services Health Talks. I'm Dr. Joshua Delito, a family physician. I have interest in public health and cancer prevention and treatment. In this video, we are going to look at worm infections in children and the ways of prevention and treatment. We are going to look at worm infections in children. We are going to look at prevention methods, and also we are also going to look at ways we can protect our children from this silent epidemic. Well, let's look at the problem of worm infestation. So, over 1.5 billion people worldwide are infested with soil-transmitted worms, or helminths as they are called in the medical language. So 267 million of these are preschool-aged children, and 568 million school-aged children need treatment for worms, according to WHO records. This is an overwhelming number. So there's high prevalence of worm infestation in sub-Saharan Africa, South Asia, and tropical region. And this is related to poor hand hygiene practices and poor waste disposal practices. So let's look at some of the worm infestation that we have. We have the loudworms. We call them Ascaris rubricoides in medical terms. We have the hookworms called, there are two types. We have Anthracytoma and the nectar helminthiensis. Then we have whipworms, and we have tapeworms and the threadworms. So why are children at risk of worm infestation? These are the common risk factors. One, poor sanitation. So waste disposal practices in most of the low economic and middle income countries is a problem. And because of this, there is a soil contamination with fecal matter, and this ends up in the hearts of children, and they get infested. We have walking barefoot, and this leads to risk of hookworms, especially in rain and marshy places, which increases the risk of conditions we call bilharzia. We have contaminated the soil. I have explained how this happens due to poor waste disposal practices, drinking unsafe water, which is not treated or boiled. This puts children at risk of getting worm infestation. And then poor hand hygiene practices. Availability of water for hand washing could be a big challenge, and this has shown to be a big cause of worm infestation in low and middle income countries. So what are some of the signs and symptoms that your child could be infested with worms? Stomach pain and bloating. We have weight loss and poor appetite. We have a persistent cough, especially due to hookworms. In their developmental stage, we have itchy bottoms, especially if they have infection with whipworms, and this is especially common at night. They may be tired. They have no interest in play. They may be anemic, especially if there is infestation with hookworms, and then they may have learning difficulties due to anemia, due to the irritation from the worm, and due to malnutrition. So, how are worm infestations diagnosis made? It's usually a stool test for offer and cyst. You can do blood test for anemia and an increase in what we call eosinophils. Presentation we call an eosinophilia would be an indicator of worm infestation. And then we have deworming medications like albendazole and the mebendazole. And then we have this should be repeated every 6 months in places where worm infestation is a common problem. So we have deworming program where the WHO has been recommending massive school campaigns and also deworming campaigns for children under 5. All children aged 1 to 14 years in high risk areas should be dewormed every 6 months. Uh, Pregnant women, and they should be done after the first trimester. And then people with low socioeconomic capacity who live in areas that are deprived of sanitary facilities should be dewormed every 6 months. And it should be typically be done through schools and also healthy facility campaigns through the normal immunization programs. Then pregnant women should be offered uh, deworming after the first trimester. So, what are some of the strategies to prevent worms? One, the old age practice of hand washing. We should practice it and teach our children to wash their hands after using the toilet before they feed, and making sure that we wash fruits and vegetables thoroughly with running water before we eat them. Then use of toilets and proper disposal of waste, and encouraging use of toilet facilities and latrines where possible. Wearing shoes when outside, especially for children playing in marshy and the water places. Washing fruits and vegetables with running water, as I've talked about it. Boiling and treating drinking water is very essential. What is the role of parents and communities? Encourage hygienic practices, carry out regular deworming campaigns, and support public uh, attempts to deworm children below the age of 14 years, and educate others in the household of good hygienic practices, and visit clinics for regular child checkups, and know this, that worms may be silent, but their damage is not. So practice good hygienic practices, deworm regularly, practice hygiene, protect your child's growth and learning and the future. If you like this content, please subscribe to the Overall Health channel, share your comments, and also like and comment below the video and tell us what have been your experiences with worms. Thank you.